just allow a couple of minutes for people to join, and then I'll kick things off with some introductions and housekeeping, and then we can start the event. All right, well, I'll start the webinar now. And first of all, I just wanted to say thank you to all of you for taking time out of your evenings, especially towards the end of the year, to join us. We have some fantastic guests this afternoon, some really engaging topics. So I'm expecting quite fascinating discussion tonight. My name is Andrew Stewart, and I'm the campaign manager for Rethink Addiction, which is a broad-based coalition of support that is seeking to change Australia's attitudes towards addiction and make it a national priority. We were formed under the auspices of Turning Point and are joined by over 40 amazing and like-minded partner organisations who recognise that changing how we approach addiction is well overdue. A couple of our partners are here tonight in the ANMF Victorian Branch and SHARC. And I'd like to thank them for joining tonight and for their continued support throughout the campaign so far. The campaign was formed to build on the fantastic platform that SBS's recent groundbreaking series on addiction has provided. Addicted Australia, if you haven't seen it, was a 4-part documentary series that took an unprecedented look at and personal look at the real face of addiction, as it followed 10 brave participants throughout a 6-month wraparound treatment program that was delivered by Turning Point. For those of you who haven't seen it yet, I highly recommend that you jump on SBS On Demand and watch it. I'll play a video now, which is a bit of a teaser trailer to give you a sense of what the show was like, and then go into a little bit of housekeeping before passing over to Dan to kick off the panel session.
I started drinking when I was 13 and I'm now 62.
I'm a heroin user, but I'm no different to anybody around me.
I'm here because I want help.
I just want to be free of the chain to the drug.
There is the possibility of recovery for every patient.
He needs to stop because he's probably going to die.
Emergency services. Is your daughter responding?
I just need something to change. I just need something to shift.
We're going to win it. We're going to win it together.
Your children will be proud of you. Your friends will be proud of you.
He's really put in the hard yards.
Stopped drinking for 9 weeks, swapped it for this boat.
And you've got so much to look forward to now.
Addicted Australia starts Tuesday 10th of November on SBS and on demand.
So before we start the panel session, I want to run through a couple of housekeeping items. First, on the structure of tonight's webinar, we'll start with a moderated panel discussion for about 30 minutes amongst our special guest speakers before going on to a Q&A session for about 10 to 15 minutes and wrapping up by 7 p.m. For the Q&A session, can I ask that everyone please use the Q&A button to ask the questions and not the chat, as this will help us identify what questions have already been asked and answered already. Next, I'd just like to say we've had an overwhelming number of questions submitted at registration, and I want to thank everyone for engaging with us so much before the event, but I know that due to the time, we won't be able to get to them all. So if you want to know more about the campaign, please visit our website, go on social media and get involved. There's plenty of ways to get to learn more. The last thing I want to mention is that this webinar is recorded and snippets or transcripts of what said tonight and asked tonight might be used in the campaign over the next coming days and weeks. With all that said, I'll pass to Dan to introduce our panelists and kick off the discussion for tonight.
Thanks so much, Andrew, and welcome to everyone for taking the time this evening to come and listen to us again. and to all the people, as Andrew said, who submitted questions, really overwhelmed with the response and really delighted to have this opportunity to talk with you. I'd just like to start by acknowledging the traditional owners on the land on which we all stand and pay our respects to elders both past, present and emerging. So I'm delighted to be able to introduce a really stellar panel tonight, really well set up to answer some really... let me just introduce that panel member now. So I'll ask people to introduce themselves in a bit more detail on the question I'm going to ask. So I'm going to start with Heather, who's CEO of the Self-Harm Addiction Resource Centre here in Melbourne. Heather, can you just say a few words about yourself and why you're so passionate about this area? Heather, are you just on mute?
Thanks, Dan. Yes, I'm really pleased to be here. I think this process is really important for us to take some time to have a rethink. Yes, I'm the SHARC of CEO, which is a service founded on the value of lived experience in service provision. And my passions are really about assisting organisations to embed and enable lived experience workforce to work beside other clinical streams of services. I've been a registered nurse since the day dot, and I remain passionate and advocate, passionate and active in that space. The other thing about me, governance for not-for-profit is also an area I'm really passionate about and feel really fortunate to be involved in a number of levels of governance. So thanks, Dan.
Thanks so much, Heather. I might move on to Oscar Grano, who's we're absolutely delighted to have as a peer support worker at Turning Point. And obviously, if people have seen the Addicted Australia series, they'll know Oscar pretty well. So Oscar, can you introduce yourself and just maybe say a few words about why you're so passionate about this area?
Absolutely. Thanks so much, Dan. It's great to be here. Yeah, so I'm very passionate about the lived experience workforce and the voice of the consumer and how important it is and how much power it has the potential to have in the conversation when it comes to rethinking addiction, and just really, implementing that, sharing lived experience, role modeling hope, walking alongside people on their treatment journey and really having that firsthand experience of relating to the people that we're talking about here, that we need to rethink how they're receiving treatment.
Thanks so much, Oscar. And last but not least, I want to introduce Pip Carew, who's Assistant Secretary at the ANMF. First of all, real thanks to Pip for helping to put this webinar together. And just if you could say words about yourself and particularly why you think the ANMF, is really keen to support this whole initiative.
Yeah, look, thank you, Dan, and good evening, everyone. I'm the Assistant Secretary at ANMF, and some of my portfolios are mental health, alcohol and other drugs, and also education. And we're really pleased to be part of this partnership. Why we're passionate is at the ANMF is because our members are passionate. We've got nurses and midwives who, and I'll talk a bit about that later, who are very, very keen to be involved in supporting the community in addiction services. And we see that we have a really important role in helping them to be able to be educated and engaged in this area.
Thanks so much, Pip. So we're going to move on to specific questions, and I'm going to ask each member of the panel specific questions and then invite the rest of the panel to add to any responses they might have. But I'm going to start with Oscar first. And Oscar, maybe if you can just start by just talking a bit about what, for people who might not know, what is peer work and why is peer work so important?
Yeah, absolutely. So look, the core of my role as a peer support worker is to share my lived experience of addiction and recovery, role model hope, and walk alongside people on their treatment journey. And I think that's something that really, I suppose, differentiates peer work as a discipline within itself, is that it's really about meeting people where they're at and minimizing hierarchy and creating connection and maintaining connection through everything that we do with them as we're working with them. And that's really the core and the focus of peer work as a whole.
And why do you think it's so important that peer work is embedded into sort of our workforce?
Because I really believe that it's the people that we're working with, to have people who have been where they have been, where they're really struggling and they're seeking help, and to be on the other side of it in a better place and in recovery, that peer workers are able to provide a perspective of what it's like to be there from the inside and really help to inform decisions that are made around, around people's treatment.
So given that and given the role that peer work has, how difficult was it providing peer work as part of the documentary?
Well, I just want to start by saying that, I felt very supported and empowered by the multidisciplinary team and the organisation to be able to build meaningful and lasting relationships with the participants. Because of this, we were able to walk alongside them on their journeys and build a consistent and reliable place for them to check in and support each other as well at the weekly peer support group. But in the beginning of filming during the group, initially it did feel a little bit unnatural, having cameras in the room and all that kind of stuff. But before long, after we got to know each other and establish connection in the group, we were able to carry on as if the cameras weren't even there. And that happened a lot quickly than I expected it to as well, which was really good. And in terms of, I guess, discipline-specific challenges in the shooting, when it comes to peer work, that's the only example that I can really think of as a specific challenge. But I will say that it's always challenging getting to know the untold story behind somebody's life, witnessing their struggle firsthand and hoping that they're able to move towards a life worth living as they define it. But in saying that, it was incredibly enriching experience to be able to work with people over a much longer period of time and be on that journey in a much more comprehensive way than what the current service structure currently allows for.
Thanks, Oscar. I mean, how do you think Addicted Australia sort of, now it's out there and the response you've heard and how it links to sort of the campaign we put together around Rethink Addiction, how do you think those things have empowered people to seek help? And what do we need to do next, really?
Yeah, absolutely. Well, I really feel that Addicted Australia has done a great service to reducing stigma, shining some light on the reality of addiction and debunking some of the myths and untrue beliefs that people have about addiction. This includes showcasing that addiction is a condition, a chronic health condition that doesn't discriminate. It can affect anybody. That it's not defined by any external characteristics, and that to be suffering from addiction, you don't have to be homeless, you don't have to be in the gutter, and it's not, you don't necessarily unable to maintain any level of social acceptability. And I think that to empower people to seek help, we need to keep the conversation open and flowing. We need to continue to create service structures and support networks that are accessible, that are not judgmental, that feel safe for anybody to seek help when they need to. And I also really think that the documentary did a great job in showcasing the value in having a long-term, multifaceted treatment model, and that greater outcomes are possible if people have access to that kind of wraparound care. It's my hope that more treatment options like this are funded into the future, and that this evidence is taken into account at every level of drug and alcohol treatment. And I also hope that Addicted Australia assists in enhancing education and understanding at all levels of healthcare. So if somebody presents with addiction problems, they're supported, understood, and they feel safe to be honest about their struggles, no matter where they seek help.
Thanks, Oscar. Heather or Pip, do you have any other reflections? Heather, just on mute.
I just support, and I'll talk about that myself a little bit, but I really like the fact that he pointed to that addiction doesn't discriminate. It's not a particular demographic that we see walking in the doors for support. And we saw that with the Addicted Australia film, but we've actually known that for years in the services that provide the supports for people. So, yeah, I just wanted to reinforce that point.
Was that anything you wanted to add?
For me, it just, what Oscar said resonated certainly with us about that multidisciplinary approach as well, the way different clinicians have a real contribution to make. And there are just so many variations in the health needs. And if we can get a model of care that can, have an approach where everyone's expertise can be used. And I'll certainly be talking about nurses later, but I think that's of great value.
Thanks so much, guys. I'll move on to the next question. These are questions for Heather. So Heather, I think Addicted Australia, what it did was it gave us, unlike other documentaries, access to people's worlds and actually going into people's homes and seeing their families. Building on that, I suppose, looking at Addicted Australia and sort of, your experience of working in this area for such a long time, what are the impacts that addiction can have on people's networks and their support networks more broadly?
Sure. So, look, firstly, I think what the film did was really highlight the broad spectrum impact of addiction within all domains of our community. And it doesn't just sit in the person who presents to treatment with the addiction. Service users and consumer movement bodies talk about the impact of feeling shame. They come into our services and they talk about shame as a corroding kind of influence in their lives. They talk about the stigma that they've experienced and the need to covet it. And they talk about a sense of isolation and separateness from the world around them. One of the things that I think is, the research says it, but I've seen it for over 30 years, is the fragmenting of relationships in people's lives, whether it be family, whether it be the workplace, whether it be significant others in many forms. We all live in a community, and very often people impacted by addiction, and I think the film pointed to this well, was that a sense of isolation and separateness is not a good thing for a holistic kind of feeling about oneself in one's world. And I just add there, which really I think supports the fact that we're talking about this doesn't discriminate, and that's what we saw with the film. But, in 2006, the ANMF and myself and a couple of people got together, and what we knew was that nurses and doctors were not somehow separate from being impacted by addiction or mental health disorder or challenges. And that was really saying that it happens everywhere in everybody's life. And what we did was we set up a nurses' health program for nurses with sensitive health issues around substance use, misuse and addiction, but also recognising that there's a doctor's health program for exactly the same thing. So those 2 points, I talk about it to kind of reinforce that it's a myth to think that addiction impacts only a certain portion of the community. And if we know that, then we've got to rethink addiction responses as being not isolated in health services or treatment services, that it actually becomes a community rethink rather than an education for specific services that provide the health intervention.
Thanks so much, Heather. Just following on from that, then let's just talk about SHARC and, why is it so important that, what place does SHARC actually play in this space? So why we've got a big health service, with lots of people doing lots of different things. Why is it critical to have an organisation like SHARC? What is it that you bring that really sort of helps address this issue?
Well, SHARC's a peer-led and run service that's been around for about 30 years. But what we've always believed is that a hybrid, that we don't own clients and we don't own client pathways, and we need to develop the kind of partnerships with clinical services that can contribute to a more holistic opportunity for, service users. Sometimes we can offer what people want and sometimes we can't. And we really need to be prepared to partner with other organisations. And, I was thinking about partnership today, and it's more than an MOU. Partnership takes time, and it takes an understanding and openness from services that there's richness in the diversity, that we all bring a different lens. Peer support brings the relational lens. Clinical specialist intervention bring that kind of specialist lens to opportunity for service users to seek, should it be something they wish to. So, you know, we've been around, we work with clinical teams. We actually have, while I say we are lived experience workforce here, you'd be surprised how many of our staff are also highly professionally qualified as well, although their lead footprint is the relational lens in lived experience workforce. So we don't for 1 minute think that we've got it all. We think we're part of a holistic approach that can really support outcomes for people.
Pip, did you want to follow on those comments from Heather?
No, other than I think probably what we've learnt by engaging with different networks is such as SHARC and Heather's network is just what the value is, the value add for people with problematic AOD use. That's where the real value is. And yes, so I just think that more and better engagement across different services is going to get the best outcomes for people who are suffering from, you know, addiction.
Maybe you can follow on from that question without notice. I mean, just in terms of lived experience, I mean, obviously in terms of nurses, you know, they work across a whole many different health disorders. I mean, is it unusual to have lived experience as part of a health response?
Do you mean lived experience in the nursing midwifery workforce?
Oh, no, I meant in terms of for other health disorders. I mean, is lived experience, you know, not part of standard care for a whole range of other health conditions?
Not so much. For mental health and AOD, I would think particular specialties that have relevance in that space. Yeah.
And I just want to say there too, in the area of cancer treatment, peer support is a really big component of Peter McCallum's treatment modality. They have numerous peer support groups established across the whole of Victoria. So, you know, I think we do see it in other domains. And I'd just like to say one other thing, and then I'll be quiet, Dan. But, you know, I think when we're thinking about a hybrid and a holistic approach, we know that we need a good clinical assessment. That includes the client and their worldview. Peer workers and lived experience workforce become allies and promote through the relational lens hope and opportunities to explore different things that might not be available in a purely clinical setting. And specialist clinical interventions in a timely manner are essential too. So no one of us has it all. You know, no one of us has it all. We need to sort of start to rethink that. And again, just that point about it's not just health services and drug and alcohol treatment and mental health treatment. It's actually a community issue. And that's what I think Rethink Addiction is inviting, some conversation and exploration in that space.
Thanks, Heather. Oscar, was there any comments you want to make?
I just really liked that, you know, talking about the ripple effect, you know, and needing recovery on an individual and a social and a community level, and really shining the light on that, because in services we focus so much on an individual's recovery when they present to the service. So yeah, it's just really great to be talking about that and shining some light on it.
Thanks so much, Oscar. I'm going to move on to some questions for Pip. So Pip, can you just talk a bit about, you know, we've heard about the importance of multidisciplinary teams, but particularly when we think about nurses and midwives, you know, how do you see their role that they play? And you know, just following up from one of the questions that we got go through Q&A, I mean, in there it talks about, you know, the importance of particular roles like nurse practitioners. Can you make a comment around the role of the nursing workforce in this space?
Yeah, Look, I think nurses are so well placed to be involved because of the comprehensive and holistic training that they have in physical, mental health and medication management. So they have that basic education. They, if you add the overlay of additional education with AOD, whether it's postgraduate or skills development and developing that capability. And when you think about where nurses and midwives are present throughout the health system, they're often the first point of contact. They're perfectly placed to be involved in screening, in being involved in harm reduction services. It's often that connection with the health system that people might have, and nurses having that education can then contribute massively, really, to the healthcare needs of people on a range of those different levels.
So thanks so much, Pip. And just following on from that, I suppose the key question is, do we have enough trained nurses to actually conduct this work, or is that sort of something we need to work towards?
Yeah, look, I think if you look at the national figures of nurses that identify where they work, the NMBA stats, it's incredibly small number across the nation. And I think we certainly need more. We need to think about what the service, and we don't just say we need more. How can we develop a workforce and expand a workforce that can really contribute to this space? So there's a range of services where nurses can really contribute, whether it's addiction services, residential rehab, whether there's an ability to actually boost the capability of services by having more nurses present in them, whether they're in state-run services or non-government sector. So yeah, I think we do need more nurses and midwives, but I think what we've learned recently over the years, where we've had the privilege to be able to access funding for education and deliver in partnership with Turning Point, what we've seen is literally hundreds of nurses sign up to be involved and learn about this clinical specialty, and undertake workshops, classes, information forums, and I think that's just it's probably a recognition that nurses in their daily work come across people, like we say. It's not a small group of people we're talking about. We're talking about people in our own families, ourselves, our friends and relatives who suffer from having an addiction, and the familiarity of understanding, I think, amongst the nursing midwifery workforce, of the burden that carries. They just, I would think, they think it makes sense just to have that fundamental education to boost the service to the community.
Can I invite Heather or Oscar? Any further comments?
Yeah, look, I just to support Pip, you know, I know that nurses are often the front of the first point of entry that people will see, and there's often a lot of triaging that goes on. And I think nurses, in my experience, are incredibly skillful at a holistic kind of assessment that is often done on the run. We might not have 29 pieces of paper, but we're automatically kind of assessing the person in, you know, in every way. And I think that it's not just the nursing workforce. We need drug and alcohol education and rethinking triggers for all the workforces that come in touch with people with addiction disorder. I think, again, I go back to the whole issue of seeing this as a community responsibility as well as the health domain responsibility. I see it as bigger than just us as health care providers. But I'm really seeing some amazing results of that partnership where ANMF and Turning Point came together, and seen some great nurses who are really well educated around DNA come into the sector now. And that's revolutionary, really, for what 30 years in the sector, and I haven't ever seen so many nurses come through who are actually equipped to hit the ground running. Normally they come in and they're really green and they haven't had a lot in their training. And I think one of the things for people like Dan's challenge is going to be working with universities to ensure that we have the right amount of DNA and mental health and general people in distress kind of training built into the curriculum.
And Oscar, any comments for you about, obviously you're working every day alongside the nursing profession?
Yeah, I'd probably just say that, the nurses that are in the space that I work in, who are really passionate about working in drug and alcohol, and who, just go the little bit of an extra mile beyond the basic clinical functions of their role, and make an effort to have a chat with clients and search for the untold story and make a little bit of connection when they've got time to. The value that I've seen that have for people, I've seen that retain people when, they've wanted to leave, discharge early. I've just seen it, have a really big impact on people. Yeah.
I might just move on, just in terms of, so many things to talk about, isn't there? But I just wanted to reflect on the fact that I suppose what we try to demonstrate in the documentary was, and you touched on it, Oscar, that multidisciplinary team, the importance, like we have in other health areas of that multidisciplinary team, people coming with different skill sets and working together because of the complexity of addiction. I just wanted, Oscar, did you have some thoughts on that approach and why you think it's so valuable?
Absolutely. I mean, it's people present with such an incredibly complex and diverse set of different needs, and the more people that there are in that multidisciplinary team, the more connected that they are, and the more that they complement each other in the approach towards helping this person with all of this stuff. It just has such incredible value in terms of how comprehensive the treatment is, so things aren't repeated, so everybody's really aware and connected with what's happening with the person. And I think that really creates a treatment process that is just really smooth. It works really well. And as a peer worker, being included in the clinical reviews and, being included as a part of the team and not separate from the clinical staff was an incredibly rewarding experience as well, to be able to share that, again, that inside perspective, and to really feel integrated into this person's treatment plan, and not just being someone, on the sideline who's there to have a chat, if you know what I mean. Yeah.
Thanks, Oscar. Heather or Pip? Heather?
Yes, he's let me unmute now. I think one of the beautiful things when we start to talk about an emerging discipline and articulating it like peer support is that we can overlook in our articulation of the value of peer work. We're never trying to overlook the value and the connection that happens with clinicians as well. So peer work has a specific place and a specific focus, which is exploration through relationship, equality within defined roles, and it doesn't in any way dismiss the connection and the passion in the work of the clinicians around them. So if organisations embed this holistic way of working, what we have is a really rich as Oscar described, a really rich treatment pathway for the clients that access our services and their families.
Thanks, Heather. And Pip, your thoughts?
Oh, sorry about that. I probably don't have it. I'd only probably be repeating what Heather has just said. But yeah, thoroughly endorse that approach. Yep.
I might just move on to just a couple of questions that come through while we're here that sort of relate to this. And I suppose there's a lot of interest in the peer experience, the peer support sort of space, and wanted to understand how you end up working in that space in terms of, what's the process to become an accredited peer support worker? What's the difference between a peer support worker and somebody who's a professional with lived experience? What's the distinction there? Oscar, did you want to have a first go at some of those? And I'll pass on, or Heather, do you want to have a first go?
Do you want me to have a go, Oscar? And then you can fill in the bits that I miss.
Yeah, sure.
Okay. So I think there's a difference. There's a lot of people that work in our sector who have a professional banner, or their lead footprint, we call it, is their professional qualifications, but they also have lived experience, which we believe brings incredible value into the service that they're providing. But it's not intentional peer work. So they still have a lead footprint that's around clinical intervention and management of risk in a slightly different way than we see with the peer workforce. With a peer workforce, it's an intentional role that's developed within very clear PDs and organisational readiness training that organisations undergo to make sure that they understand that. It's not a quick process embedding peer workforce as a new discipline into clinical services. And I'll take my hat off to a few of them, and Turning Point is one, who've invested in what's needed to enable that, to enable that to work. But peer work is different from a clinician who has lived experience, because the way we look at risk and the way we look at the intentionality of the role is different. Please add something to that, Oscar, that I've missed, if you would like to.
Yeah, sure.
And Oscar, why are you getting?
Oh, sorry, Dan, you just muted.
Yeah, so just while you are getting your thoughts, just related to that is that there's a number of questions about how people can get experience of potentially working in this area and what's the pathway to get there, and maybe relating to your own story of how you got into it.
Yeah, absolutely. Well, what I've found, what I've come to learn is that, most frontline peer worker roles are entry-level positions, and most, from what I've seen from different, PDs and jobs that I've explored and stuff is, having the kind of base, certificate 4 in drug and alcohol, or at least be studying it. For me, I enrolled in a diploma of community services, and then I just started looking for jobs, and I found this job on Seek for a peer support worker. And what I learned was that to be employed as a peer support worker, what really qualifies you for the role is your lived experience, and your lived experience in recovery, and having strength and being fortified in your own recovery, so you have something of value to role model and to share with people who are seeking recovery, and along with all the discipline specific training that SHARC does. And there's a lot of peer support groups in the community, which I spent a lot of years in before working in the space. And the training that I did at SHARC really helped to bring a new language to the ideas of peer support that I'd been around for many years, and then also how that idea is implemented in the medical model and in the clinical space.
Thanks so much, Oscar. I might move on to some other questions and some questions that have come through from the audience earlier today, since last week, since it was advertised. I suppose a key question is around other professional groups, and sort of, I think primary care is a good example around how, obviously the documentary very much focuses on an addiction sort of a specialty centre, but we know that, so many people are touched and have the opportunity to sort of connect within primary care. I suppose, what are people's reflections about what we need to do in that space to sort of better support people in primary care, and obviously a lot of nurses play an important role in that primary care community health setting. Pip, did you want to
add to that? And Dan, I think you did ask before about the value of, for example, nurses and nurse practitioners are a very, very important element of this area, because they're able to operate autonomously, and we have certainly a number of nurse practitioners who have the specialty of alcohol and other drugs, and fulfill a real need, particularly in, for example, regional areas, or those areas that don't have the services that are in the metropolitan region, I guess. And I know there are many examples of how the healthcare needs are met by nurse practitioners who don't have access to, for example, addiction treatment services and rehabilitation services. So they do fulfill an enormous gap, and we'd love them to have more support with more addiction medicine services available to them, so that they can refer into, ensure there's the follow through of treatment. But it's a really valuable, important role. Yeah.
Thanks so much.
And if we can't afford doctors, then let's employ more nurse practitioners. They don't cost as much, and they do an amazing job. Anyway, sorry, just a little political thing there.
And on that, can I just do a shout out to Dana, the Drug Alcohol Nurses? I mean, they do some fantastic work. They've got some great resources, and people should check them out in terms of the work they've done in this space and the resources they have. Question to you, Oscar, again, around the peer work that appeared in the show. What were, you've talked about the challenges a bit. What do you think the hardest thing in those sort of peer sort of groups, what's the challenges in engaging people, do you think, and how do you sort of, what are your strategies in terms of getting people to build that trust and connect?
I think one of the biggest challenges is when people are at different stages of recovery. And I think something that really helps is to really, in the space, encourage to focus on the similarities and not the differences. And, the similarities of the condition that we all suffer from, and ways that we're able to move forward. And again, just really seeking for pathways where connection, is possible, and to really make it clear as well that, in terms of the expectations of the space, and that it is a non-judgmental space, that people are going to have different goals, they're going to be in different places, and that needs to be respected, and really identify the equal level that we're all there, meeting on, and what we're relating to together. Yeah.
Thanks for that. Heather, can I just ask just a couple of questions around family? And we saw on the documentary the issue of the family care support group. Can you just talk about the supports that are available for families, and if you're working in this field, sort of how do you direct people in this space, and what's available, and what do we know what works?
Yeah, thanks, Dan. Look, we've been lucky in Victoria in that the department have taken a very positive attitude to getting some funding for families in their own right as people who are impacted by addiction and have a whole family unit that they're trying to maintain some sort of wellness status, as well as looking after and supporting the person with the addiction. I think families, as far as like thinking about the messaging of Addicted Australia, families are great levelers, because they're out there talking about, if they can find a safe space to do it, the impacts of living with addiction. And they really bring to the forefront the fact that, you know, it's not an isolated condition within one individual. It affects families and it affects communities. And look, there's all kinds of resources, I believe, on the Rethink Addiction website about family support. That tends to be national support, but within Victoria, we have 24-hour helpline for families that's run by families themselves who have been trained and provide that immediate response. There's 24 peer support groups around Victoria now that people can go and participate in, and there's several streams of family counselling, from you know, a deeper family therapy type environment to brief interventions, and they can all be found through the Direct Line you know, database.
Thanks so much, Heather. Loads of questions coming through, so thanks everyone for your questions. We might be on till about 8 o'clock, but we're going to try and finish at 7. Few questions about the documentary. I don't know if you can share, Oscar. So a couple of things around, you know, obviously people want to know how people are traveling, and obviously there's, you know, issues of confidentiality here, but do you want to just say just how you think being involved in the program more broadly was helpful for people involved, and maybe some of the things that we didn't, you know, couldn't be shown in only the 4 hours that we had, that you think, you know, are important things for people to take away in terms of what was available for people?
Yeah, absolutely. Well, I think from a very broad perspective, you know, almost everybody who engaged in the program they're in a better place than they were when they began, and a lot of that has to do with also being presented with such a multifaceted option, and then learning what resonates with them, what doesn't, what's going to work for them, what's not, and building their own recovery, and then seeking their own help outside of the program from what they learnt within the program as to what works with them, and carrying that forward. You know, because I really believe that, you know, somebody's recovery is as individual as their fingerprint. And I think that's why it's so important to present such, you know, a multifaceted option, so people can explore everything that there is to explore and see what works for them, because it's going to be different for everyone.
Thanks so much, Oscar. Maybe a question both for Pip and Heather, and some questions around sort of how, you know, obviously we're identifying lots of possibilities and opportunities. How do we, what was the best way we work together to sort of help government to make the right decisions in this space?
Mm-hmm. Oh, well, I think,
you know all the answers, don't you?
Sorry, I think the program that is a great starting point, and I think Rethinking Addiction is just demonstrates that everyone can contribute, and we can contribute in a way that will save money. And I think that's a really powerful message to government, because developing a model of care where you've got discipline-specific interventions will ensure that people hopefully don't present in emergency departments, other health services, deteriorate with their physical comorbidities. So the cost savings and the value add to that has to be compelling for a government. So if we can all get together and have a think about how that can be packaged up and demonstrate how we all can contribute to that, I think that's a good start.
You're muted, Dan.
Oh, tricky.
Can I just put a little bit in there? You know, I think supporting what Pip said, but it also saves lives. So, you know, when we actually get a holistic kind of treatment that has step up, step down, works with the client where they're at, and comes from a non-judgmental space, we actually see lives saved. So I think there's two drivers, cost saving and saving lives. And what I'd really like to see is that the Rethinking Addiction campaign starts a conversation, a strategically building conversation. And I imagine this kind of national summit that, you know, where we bring people with all kinds of interests in the space and expertise and things they want to bring, and really take this conversation further. Because it's a great conversation, but it needs some more steps, and I think this is part of it.
So many questions to go through. I mean, it's great. Obviously, it's great to see so many people's interest in this space. Can I just, Heather, I know in the interest of time, just very briefly, just a minute. I mean, I think a couple of people brought up the issue of gambling, and sort of, I think the recognition of gambling as part of this was important. And obviously, that's something that's often very hidden. Can you say something, because I know you guys are doing work in the gambling space at the moment, and sort of what are your key messages there in terms of how we think about that?
2 minutes, I promise. So what we found with working with families was that so many times on our data sheet, the gambling would be put across as a secondary issue. So, you know, their loved one had drug and alcohol, but they were also gambling, or they themselves were starting to gamble with the stress. So we stopped seeing it as a separate thing, and started to work on addiction as a condition rather than a substance or a particular behaviour. And, you know, SHARC now is in the gambling space, funded to work in the gambling space where there is addiction present as well. And at the moment we're working in the family space, but we would like to think, if not us, others can continue to, you know, get the right kind of support to provide the right kind of support for people.
Thanks, Heather. And that was 2 minutes as well, so congratulations.
Thank you.
A couple of people have asked about Series 2, so maybe I'll just say that we're just recovering slightly from Series 1, and that, but you know, I think a couple of things, you know, having done the documentary, you know, we've learned an enormous amount. You know, first of all, we didn't actually know whether anyone would put their hand up, and secondly, you know, we didn't know whether putting this model of care together, you know, would come out in the way that it has. I think for us, you know, there's a lot of learnings in this, and, you know, if we were to do it again, I think there's a lot of other things that weren't documented in the series. A couple of people have put in the questions. I mean, I think the role of financial counsellors. So the important, I think the key thing is we have a multidisciplinary team, but we, you know, the team needs to be a lot bigger. You know, there's so many different aspects where addiction touches on so many different parts of people's lives. So ideally, you know, financial counselling, linked to employment, linked to housing, you know, so many important bits in terms of supporting people's recovery. Oscar, did you have a thought on what would you like to see in Series 2 of things that we didn't have that we could add in if that was to happen? I'm not saying it will happen, but if it was.
Oh, geez. So I think, you know, maybe more like scope to like more outreach kind of stuff. You know, like working with people in the community more, you know, even perhaps, you know, options for a second, you know, peer support group that's held online, and have one that's physical and one that's online. I mean, there's a lot of stuff from COVID in the delivering of groups and treatment and stuff that I think even after COVID would really have great value to people who, you know, might have trouble getting there physically and things like that. And yeah.
Thanks, Oscar. So many, you know, great things that we can do. Now, I'm just aware of the time, and we want to make sure that you have a good rest of the evening. So I'm just going to take this opportunity to thank Oscar, Heather and Pip for taking part this evening and supporting this, and thanks for everyone involved. I'm going to ask Andrew to come back online, and I suppose my question for Andrew that he can share with us is, you know, thinking about the campaign. Obviously we've got this campaign up and running in record time, and we've been blown away by how much of the health system and other parts of the community have got on board in terms of organisation. But, you know, what are your thoughts, Andrew, about where we go from here? And, you know, we've had lots and lots of questions about how people can help or get involved. Yeah, what are your thoughts in that space?
Yeah, absolutely. Thanks, Dan. And echoing your comments, thanking the guest speakers tonight for their wonderful contributions, and apologising to everyone for not being able to answer all your questions. It's some really fantastic ones. And I would encourage you all to continue to get engaged with the campaign, and keep asking these questions, keep having these discussions. In terms of what we can do to get involved and change the conversation, at the moment, the best way to help out the campaign is to jump on the website and sign the petition, follow us on social media, and encourage all of your friends, family, and networks to do the same. We really want to grow this campaign to be a self-sustaining body that everyone across Australia from all walks of life has access to and can see. Obviously, the SBS series was a fantastic first start, but SBS is a very select group of viewers, and we need to take this to all of Australia. So anything that you can do to encourage your friends and family and wider networks, neighbours, you know, the person down at the post office, coffee shop, things like that. Talk about the series, encourage people to go watch the series on SBS Demand, and get engaged with the campaign in any way that you can. As I said, the petition is one way. We're also committed to bringing the human face to addiction, and breaking down that stigma, which we've talked about quite a lot tonight. And one of the ways we're doing that is sharing real stories. So if you've got a story of how addiction might have affected your life or the life of someone close to you, or potentially in your capacity as a peer worker, clinician, nurse, connected to addiction, we'd love to hear your story and share that and start to break down that unhelpful stigma that's stopping people from seeking help, because we know on average is about a 2-decade delay before someone starts to actually ask for help with their addiction. So I think that's probably the quick summary of how you can get involved. Rethinkaddiction.org.au is the headline for tonight. So Google that as soon as you get off this call. And if you haven't already, sign the petition, follow us on social media, and tell your friends to do the same. And that's all from me tonight. So Dan and the rest of the panelists, unless you've got anything else to add, I just want to say thank you again. Have a restful holiday break, and looking forward to expand the campaign throughout 2021 onto bigger and better things.
Thanks, everyone.